Well, before guys and girls, ladies, gentlemen, boys and girls, ladies, boys, men, women, adults, old people, some children, and teenagers that do smoke underage and illegally, what would they think about this new ban that's coming in? GBLT or GBL, live news, but could quitting MP reverse plans that soon means smoking adults can't buy any. Does that mean they buy cigarettes off the black market? But some people ignore that. I mean, you can still drink spirits and get high. Some people take cocaine. Some people take cannabis. Um, if you can see what I'm trying to say on here, it says here, if you could see for yourself, this guy's talking about it, and this guy's speaking about it as well. Apparently, they're going to be banning cigarettes in the UK. What about Northern Ireland, Scotland, Wales? Will other countries follow suit? So I might put it to the beginning. So what do you guys and girls and ladies and boys and girls think about it? Moms and dads, aunties and uncles, friends and family. Would they agree with it? Would they not? But people still can get hold of cigarettes in probably different places and they have to go to the black market or something. Let's rewind it to the beginning and see what you think about this video.
So if Richie Sunak gets his way,
Richie Sunak gets his way,
some adults will be banned from buying cigarettes. 6.4 million people in the UK smoke, but if Sunak has unveiled plans to make it an offence for anyone born in 2009 or afterwards to be sold tobacco products, so the legal smoking age would then be increased every year. They did this in New Zealand, which brackets itself as a lovely, fluffy, soft democracy of liberalism, but is actually, as was evidenced during the coronavirus crisis, one of the most totalitarian and authoritarian countries that I've ever seen. So it just doesn't really sit that well with me. I get that smoking is bad for you. I get that a minority of people smoke. I get that people don't like the smell. All of this stuff. But I just don't think it's right to ban things. Keep banning them and banning them and banning them. And we will end up in a situation where a 40-year-old man is standing outside a Spar or a corner shop in Basingstoke asking a 41-year-old man to go in and buy him a packet of Marlboro Golds. And that is ridiculous. Let's speak now, though, to Dr. Sudhanshu Patwardhan from the Centre of Health Research and Education at Southampton University. Thank you very, very much. So, do you think this will actually make a massive health difference to society to the point where we need to ban it all?
First of all, thank you so much for having me on this show. Just a quick correction. I am based in Southampton at the University of Southampton Science Park, so I'm not at the university per se. And our Center for Health Research and Education is a private healthcare company. We are working in tobacco cessation, and a lot of our work is done in the UK, but also in South Asia, particularly in India. So let's jump to the topic. What exactly is the question you want to ask?
What's the point of banning smoking?
Well, smoking, look, I'm a doctor by training, and it's very evident that tobacco smoking, especially in the UK, where...
This is Southampton, by the way, in the UK, if you live there.
Policies have been put in place which have chipped away at the number of people smoking, and the prevalence has significantly dropped down. But you know what? You mentioned 6.4 million people continue to smoke tobacco in this country. If you look at the data, it is very evident that tobacco use is an inequalities issue, which means that those who are socioeconomically disadvantaged are more likely to be smoking, and that's essentially widening the inequity gap. So anything that is going to help current smokers from quitting tobacco is a good policy measure, and I think that's what I like to focus on. Now, if you want to talk about this proposed policy measure for future tobacco users, look, it can't be treated in isolation. It has to be part of a broader mix of policies. And bear in mind, this comes from a recommendation by Dr. Javed Khan from his report, independent report that he published last year on the government's commissioning. And this was one of the policy measures, but this is not the only one.
But it's not going to work, is it? I mean, cocaine is always illegal, and we've got more cocaine users than we've ever had in this country.
Look, I do not know the numbers about what happens with other drugs used. This is about sending the right message. And think of it, for the first time in the last few years since COVID, a government, and I believe other political parties, are all aligned with this policy goal with regards to public health. Now, how often do we get public health to be on the top of the country's agenda?
Well,
And I
actually,
think
well,
this
it's
is a
interesting,
signal that-
but it's interesting you said since COVID, right? Because during COVID, we had a load of incredibly draconian measures placed on us by medical professionals that actually turned out to destroy a lot of people's lives and lead to a lot of excess deaths. That has happened, okay? So why should we now, as a nation, be told by medical professionals what I, as a consenting adult, can and can't do? Why do you want to control my life?
I do not want to control anyone's life here. I think my role, and as a medical practitioner, I believe that those smokers who need help to quit should be given and offered that help. And I think government's role is to make sure that that opportunity is available. So look
But
at
by banning it.
the biggest.
They're banning it. It's not extra nicotine patches. They're not going around saying, "Do you want to quit? Here's a vape." They're banning it.
Yeah, and that's where I think the discussion really has to move away from what the policy measure is going to do, but what are the solutions being offered to current smokers. I always feel that any of these debates often forget that those 6 million plus people in this country and another billion plus around the world are not getting the right level of advice from their governments, from their medical practitioners, people around them. And I think that part of the debate is always sort of forgotten. It's almost like the government, the healthcare practitioners saying, you know what, we do not really care about your health, and we know you're going to die 15 years earlier because of smoking, but we want to focus on the only on the future generations, which is important, but not the only thing to focus on. Do you see what I mean?
Yeah, not really, because on the packets of cigarettes, you've got a picture of a diseased lung, a throat tumour, or one of them, is my personal favourite, is a man crying in the fetal position on the bed to say how smoking causes impotence, right? So we don't have any branding on them, so everybody knows that smoking is bad for you. But sometimes a hypothetical 31-year-old man walks into a newsagent and wants to buy himself a packet of cigarettes because as an adult he makes that decision. Why shouldn't I be allowed to do that?
That's a great question about personal choice. And look, as a medical professional, I'm not going to get into the debate about where does one draw the line on personal choice. I'm so sorry to say that. I think where we have to not forget is if an adult is smoking, it is affecting their
Coughing
chance of
again.
living a happier, healthier, longer life, and for those around them. And it's up to healthcare professionals, governments, and those around them to be able to at least offer this support to quit nasty forms of tobacco.
Well,
And
do you,
here I can
do you think we should ban junk food? Do you think do you think that we should ban burgers being sold to children?
Now, look, I think that is a debate that always goes on, right, in the society, and where do you draw the line, what is acceptable, what is not. And
Sounds
I
like
do not
people
wish
they want
get
to
back
control
purely
people to
because
me.
There are many more experts who can talk about it.
Like
What I
people do
can
what they
talk
want to
about
do,
is, look,
over panicking, worrying.
next generation of nicotine users in this country is absolutely not required because currently the view that is prevalent is that tobacco products that are in the market are causing only harm and nothing else. And I completely sign up to that. Now, let's switch gears and look at where does nicotine fit in this broader context. Yeah, and I would like to just take a minute to talk about this, please. Tobacco products, so combustible or smoked cigarette products, for example, or even smokeless products that are very commonly used among the South Asian diaspora in the UK, and there's about a few 100,000 people here who consume those products. Uh, these cause the harms from tobacco, either burnt tobacco or toxicants. Now, nicotine in these products is the dependence causing chemical psychoactive substance. However, people often mix the two up in terms of mentally thinking that they're all the same thing. And a recent survey that I was quite fortunate to see the data from, and it's now public domain, is that shows that doctors around the world, all around 12 countries where this survey was conducted among 15,000 doctors, they wrongly believe that nicotine in these tobacco products causes cancer. Now imagine the same doctors are expected to provide, you mentioned nicotine patches earlier, right? Nicotine patches, or in those countries where electronic cigarettes are approved and allowed, or even nicotine pouches. Doctors will not recommend these products to their patients for long-term use to quit smoking or to quit tobacco because they harbor these wrong perceptions. And I think that's the big area of what we need to work on. That's what we really do in our center, trying to educate healthcare practitioners to be better at supporting the current users of tobacco. And that, I think, is a big part in itself.
Good stuff. Well, thank you very, very much for coming on. It's been an absolute pleasure, I must say. Great to get your views. Dr. Suhanshu, perhaps Warden there, from the Centre for Health Research, somewhere near Southampton University, I think.
So what do you think, guys and girls, ladies and boys, girls? Do you think it's the right thing they're doing, or do you think it's bad that they're stopping smoking? Some people would say yes, some people would say no. Will it cause a lot of problems? Will it cause rioting? Will it cause kicking off? It probably will do. People want the smoke to relax, or a coffee, or a tea, or smoke weed, which some people do. Who knows? If I could join me in this video, and I'll see you in the next one. Take it easy, peace.